Thank you very much for giving me this opportunity, and I do need to acknowledge the help of Lucy and also Mika sitting over on the right who worked for this presentation. So I'm going to briefly go through the methods and then some of the results. This was an online survey which was administered through the EAPC office in Milan with the help of Emilia Giordani, without whom we've never got the database we did. The study was widely publicised to all EAPC members and any of the delegates who came to the conference in Lisbon the previous year. And then we presented some preliminary findings from Trondheim, but we looked at the distribution of countries we've got, and then we specifically targeted some national and international organisations in those countries. We do realise that in setting up the questionnaire, we didn't have time to consult with some of the patients and carers, and hopefully today we're making some progress on that. The study had ethical approval, and we were finally able to open the study for 18 weeks, starting from the 4th of April. As I said, there was a poster at the EAPC conference in Trondheim from 708 patients, and then we subsequently had another 200 patients. So this just shows the international nature of the survey. As you can see, the biggest group is actually Europe with 713 patients, but we do have patients from all continents, so it's quite a successful survey. 971 respondents, mean age of 48, 64% female, and the majority of people working in a clinical setting. Only 24, or less than 2% of the people who responded to the survey said they didn't think there was a need for any further research. So, 98% felt that there was a need for more research. This just gives you a better breakdown of the occupations of the people responding to the survey. So the biggest group is palliative care physicians, but there are also palliative care nurses and chaplains or healthcare service spiritual care providers, plus other groups. So quite a representative sample. We also asked the respondents if they were religious themselves, or they did have an option that if they didn't wish to disclose it, they could tick that. So most of the respondents were Christian, 10% said they were spiritual but not religious, and then there were a number of other religions as well. So again, perhaps not quite as representative as we would like on an international basis, but we still have quite a good spread. The actual questionnaire fell into two components. There was a quantitative section and a qualitative section. So for the quantitative section, prior to the survey, the task force came up with what we thought were 15 research priorities. And if you look in your handouts, you actually do have the full list of 15, but they were never going to fit on a slide for everybody to read. The respondents were then asked to look at those 15 and choose the top 5 and then rank them with 5, 4, 3, 2 and 1 point. And then we summed up all the scores for each priority and then we ranked them. So the 6 highest priorities are given at the bottom of the screen. You might want to, in a few moments I'm going to show you the qualitative results, which are very similar, so I won't go through them in any great detail at the moment. And if you want to look at the complete ranking, that's actually in your handouts. So this is the quantitative findings. In addition to looking at those 15 priorities, there were also 4 open-ended questions. We asked the respondents if there were any other research priorities that we hadn't identified. Then we asked them what they felt was the single most important research question to improve spiritual care provision. And then there was a question about research methodologies and additional comments. And I'm not going to touch those last 2 in view of the fact that I don't have very many minutes left to talk. All the 917 responses were then looked at on a thematic analysis by Lucy and Mika. And again, you've got the complete list of the priorities that they identified. So, in answer to were there any other research priorities that we missed, just under 50% of the respondents said, actually, no, everything was in your list. But the priorities that were identified, probably understanding of spiritual care is the one that we really did miss out from that original list of 15. Looking at staff education, understanding spiritual needs and distress, spiritual care for non-religious people and people of different faiths, and definitions of spirituality. The most important research questions, if you look at the bottom, you'll see that the two lists are very similar. They're not quite in the same order, but there was a very distinct clustering of, there's a big gap between the fifth and score, but the fifth and sixth on both the quantitative and the qualitative. So I think we did get the right balance. So top of the list on the quantitative was actually responding to spiritual needs and evaluating spiritual interventions, investigating effectiveness, understanding spiritual needs, identifying spiritual needs, so screening, and then questions related to spiritual discussions and the conversations. So again, very similar. The one topic that came up in the quantitative result, not in the qualitative, was prevalence. So that was, I think that was about 6 in the quantitative. So in conclusion, we had a large international sample. There was almost universal agreement on the need for further research, which is why we're all here today. And the findings suggest 3 key priority areas. So how do we respond to spiritual needs? Developing interventions, determining effectiveness. How can we help staff to talk about spiritual issues, so conversation models, barriers? How can we identify those spiritual needs, screening tools and assessment? And across all those, there is this idea of understanding spiritual needs and patient preferences in a multi-faith and multicultural population. In some countries, that's definitely a very high priority.